This is the case of a patient with ischemic cardiomyopathy implanted with a CRT ICD. He was lost for follow-up for a very long time and then came in the hospital because he had received multiple episodes of electrical shocks. If you look first at the curve of the RV pacing impedance, you can see first normal values and then a sudden increase in the values with an abnormal value over 3000. You can see here the same pattern in terms of RV automatic pacing threshold with first normal value at around 1 volt and then a sudden increase in the pacing threshold. You can see also an alteration of the quality of the sensing with a progressive decrease from 10 millivolts to 5 millivolts. When we look at the memory of the device, we could see that there were multiple episodes diagnosed non-sustained ventricular tachycardia. There was also in the memory of the device one episode of VF, diagnosed VF, requiring 6 electrical shocks. When you look at the plot, it is characteristic of a lead dysfunction or of a faulty connection. You can see a cloud of points with very fast cycles at the limit of the blanking and a lot of variability in the ventricular cycles. In this episode, 6 maximal shocks were delivered, and this example highlights the interest of limiting the possibility by the device to deliver at maximum 6 electrical shocks during the same episode, because you can understand that when the shocks are inappropriate, this is very poorly accepted by the patient. The EGM is characteristic of a lead dysfunction. You can see very fast cycles. Some of them are at the limit of the blanking, completely disorganized with variable amplitude. Some of the cycles have a very important amplitude saturating the amplifiers. This is clearly in favor of dysfunction of the conductor of the lead. So clearly the cycles are not related to the QRS and they are intermittent during the cardiac cycle. This is an historical presentation of lead dysfunction, since in these patients we observed every dysfunction that was possible. We had an increase in the threshold, an increase in the impedance, an alteration of the quality of the sensing. We also observed very short cycles, episode of non-sustainability, multiple episodes of non-sustainability, and an episode with multiple shocks. And this tracing also highlights the interest of the remote monitoring to arrive to an early diagnosis of lead dysfunction. For example, when you can see occurrence of short cycles or of non-sustainability or of an increase in the impedance, to prevent the occurrence of multiple inappropriate therapies.